Well, good morning, everyone. It's great to see you all and a pleasure to be included in this virtual Seniors Active Living Fair. My name is Paula Duncan, as Maha said, and I am a Caregiver Education Counsellor with CHATS. I'm going to do two parts, or try to do two parts for this presentation, to tell you a little bit about CHATS and its programs and services. And then I will do that workshop on what is elder abuse. So CHATS stands for Community and Home Assistance to Seniors. It is a not-for-profit organization providing service through a wellness framework that enhances program planning and service delivery through healthy aging. So what is a wellness framework? Well, a wellness framework is a tool that looks at a combination of factors such as social, economic, environmental, cultural, and political conditions identified by individuals and their community as essential for them to flourish and fulfill their potential, thereby fostering individual and community well-being. So our CHATS team work to empower and enable older adults to embrace all that their community has to offer, from personal care to healthy aging information. CHATS is committed to helping older adults to live best at home and in their communities. So how does it work? Well, CHATS programs and services are available to older adults and caregivers. They're designed to meet clients' unique needs and wants. They're aimed at keeping costs low. Subsidies are available based on a financial assessment. Each program has its own eligibility requirements and costs associated with it. Programs that are free, I will mention as we go through the presentation. As well as I will provide the contact details at the very end. Okay, so this is a map of our catchment area. So we have North and South York region, and then we have South Simcoe. Just to kind of update you in terms of the impact on COVID, all CHATS programs and services are operating. Some programs and services have been adapted to best meet the needs of clients while keeping safety a priority. Many of our programs are offered virtually, so all clients are included. I was going to stop and show you the website, but if we've got time, I will jump into that after. Let's talk about how CHATS can help. So I will begin by talking about the community transportation. So our drivers escort clients to and from things like medical appointments, errands, shoppings, and of course CHATS programs. There is a cost for this service. However, clients can have someone go with them to appointments as needed at no extra cost. CHATS does have a wheelchair accessible van, but that is only available to the residents in the Bradford, West Gwillimbury area and New Tecumseh. So again, contact CHATS main line if you are interested or needing transportation. We do also have a Meals on Wheels program, and that offers more than 100 frozen entrees, soups, snack packs, and desserts. So it's just a matter of heating and serving. We also have special dietary menu items available, and this service is for all of York Region and South Simcoe. To make an order or place an order, you simply call CHATS main line, or you can do so online. Next, we're going to chat about the Adult Day program. So currently we're operating at a reduced capacity. Referrals for the ADP program, short for Adult Day program, must come from the Home and Community Care Support Services, and they were formerly called LIN or CCAC. There is a wait list for the program. The Adult Day program is a full day program. It provides clients with social and wellness activities, a chance to socialize, nutritious snacks, and of course a lunch. There is, of course, a cost attached to this program. Then we have the in-home service support service. This program offers a home support worker who assists with activities of daily living, including light cleaning, laundry, meal preparation. There's also personal support worker who will assist with personal care needs such as bathing, toileting, and dressing. And this service does have a wait list and a cost attached. Next, we're going to talk about the Caregiver Respite Program and Personal Care. This program helps when caregivers need a much needed break or some help at home. So this personal support worker will assist with personal care needs, including meal preparation, light cleaning, bathing, toileting, and dressing. This program is still available, but there is a long wait list, and of course, there's a cost attached to this. A visiting program is where a CHATS volunteer will connect with an older adult on a regular schedule. So we use 3 modalities for this: telephone visiting, virtual visiting, and pre-pandemic, we were doing in-person friendly visits. We're working on bringing back the in-person visits. This program provides peace of mind to older adults as there are safety components involved. For example, if someone does not answer a scheduled call, the non-emergency police line is contacted and that person is followed up to ensure that they are safe. This is a free service. Next, we have our social and wellness program. So this promotes, the idea behind this is to promote health and wellness and provide social engagement based on client needs. It's a great opportunity to mix and mingle, meet new friends, and have fun. Programs are currently held by teleconference and virtual meetings, but we are in the process again of returning some in-person programming, and there is a cost attached to this. We also have the diversity, wellness, and outreach programs, and they are currently offered by Zoom and teleconference. There are over 40 programs offered, and they range from bingo and trivia to health and wellness to armchair tourism to fitness. So this program is open to all residents of York Region and South Simcoe. It looks to promote the well-being and provide activities for older adults from the Italian, Iranian, Russian, South Asian, and Tamil communities, along with other mainstream communities. It offers a holistic approach to wellness, provides opportunities for social interaction, even the celebration of events and resource development. And we are starting to go back to some in-person programs, and there is a cost attached to this. Next, we're going to talk about the Phillips Lifeline. So CHATS Phillips Lifeline offers safety and security to residents in York Region and South Simcoe. It provides peace of mind to the person served and their family through 24/7 monitoring. In the event a person needs help, by just a press of a button, Lifeline dispatches assistance to their home. There is a cost involved for this, but subsidies may be available through Phillips Lifeline for eligible older adults. And then again, you could contact CHATS for further details. Then we have our Home at Last program. This is a free service arranged from the hospital. Safety is priority, and avoiding the return to hospital is the premise for the program. Participating hospitals are Mackenzie Health, South Lake Regional, Oak Valley, formerly called Markham Stouffville, and Stevenson Memorial. This service helps to make the transition out of hospital to home safer, easier, and more pleasant. Patients are driven home from the hospital and a support worker gets them settled in safely at home. And again, we simply contact CHATS for further information. Now we're going to talk about our Home Adaptation and Maintenance Program, or HAMP for short. For older adults wanting to remain at home and maintain their quality of life, the HAMP program will do a free home safety assessment and make recommendations. Adaptations can include grab bars, ramps, stair lifts, handrails. There's also a maintenance service that's available, which would include lawn cleanup, snow removal, eavesdrop cleaning. The eligibility requirements for this are adults 55 and older, and or persons with age-related conditions, and this is only offered in the north part of York Region and South Simcoe. So those areas are East Gwillimbury, Georgina, Bradford, West Gwillimbury, Newmarket, Town of Tecumseh. Sorry, not this area, but we've got other things. The handyman service offers odd jobs around the house, so things like replacing door handles, hanging blinds, changing light bulbs, that sort of thing. These two programs are offered in only for the North York Region and South Simcoe. So next we look at our tenancy risk program, and this CHATS is partnered with York Support Services Network and the VHA Home Health Care to provide this service. So for those at risk of losing their tenancy due to hoarding, uncleanness, clutter, under-maintained homes, that is what the program is about, and it includes an assessment, individualized service plan, and an ongoing care plan. And if this is something that you need, or you know of someone who needs that, please connect with CHATS on that. Next, we talk about the caregiver support and education. And before I get into this, I want to first define how we see a caregiver. So a caregiver is defined as an unpaid individual, including a spouse, a relative, a friend, a neighbor who provides direct and or indirect care to a recipient. So this program is offered free of charge and supports caregivers through individual counseling, support groups, workshops and information and referral services. The idea is to promote caregiver health and well-being, to enhance the caregiver coping capacity, and to help prevent burnout. To be eligible for this, you simply need to be, for all that I mentioned, to be eligible for all those services, you must be a caregiver who resides in York Region or South Simcoe. For caregivers living outside of York Region and South Simcoe, you are only eligible for the information and referral service. Currently, we are providing our services using the Zoom platform and by telephone, and no referral is required. So you can contact CHATS, or I have my contact information here, because as a caregiver, this is kind of my area. So next, we will talk about our hospital to home program. So CHATS is working with hospitals to develop and implement programs to support the safe discharge to patients with community support. So the hospitals involved, as you see here, Mackenzie Health, South Lake Regional, and Oak Valley. It's important, though, that if you or your care recipient are admitted to one of these hospitals, to make sure and ask about the program. It is way more involved than the Home at Last program that I mentioned earlier, because there are many more professionals involved in helping to create a care plan to support clients' safe discharge from the hospital to their home, with that added part of having community support. So this concludes the part one of my presentation, and we will do questions at the end of the next part. But again, if you have any questions on any of these programs or services, you can put them in the chat. If you're interested in any of them, you can always have a look at our website, which is www.chats.om.ca. Okay, I'm just looking at my time and trying to be sensitive to it. So as a caregiver education counselor, I do presentations and workshops like I'm doing now on various topics. So part two of my time, I will do the first module in a series entitled, What is Elder Abuse? And as a warning, this content I'm about to present can be triggering. So please do what you need to for your own self-care. So to begin, I will start with a definition of elder abuse, and this is taken from the World Health Organization, dated June 15th, 2021. So it says, elder abuse is a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust, which causes harm or distress to an older person. This type of violence constitutes a violation of human rights and serious loss of dignity and respect. So just to look at some stats, and I will add to what I have here on this slide. So this again is coming from the WHO. So in the past year, and we're talking about 2021, 1 in 6 people 60 years and older experience some form of abuse in community settings. According to the WHO, data on abuse of older adults in hospitals, nursing homes, and other long-term care facilities is scarce. But a survey of nursing home staff in the US suggests that the rates may be high, with many staff reporting that they have seen abuse, and with 2 in 3 staff reporting that they have abused someone in their care in 2021. The survey reported that 36% of the staff witnessed physical abuse. 10% were perpetrators of physical abuse, and 40% were perpetrators of psychological or emotional abuse. Elder abuse has devastating consequences. It can lead to serious physical effects such as injuries, lasting disabilities, worsened health conditions, and can have psychological or emotional effects such as anxiety, loneliness, and a loss of dignity, trust, and hope. A survey done in the US tracked older adults over a 13-year period and found that those who reported being abused were twice as likely to die than older adults who did not report abuse. Additionally, the data shows that elder abuse can happen at home. Reports indicate that 90% of all abusers are family members, be it children, spouses, and partners. But only 4% of this abuse is reported. Why? Fear of retaliation, worry about the abuser getting into trouble, being mentally incapable of reporting abuse, feeling shamed or embarrassed. With the global population of older people increasing, the absolute number of people who will experience abuse is predicted to increase. Now, as we look at elder abuse and in our current or past 2 years of COVID, and I'm going to add again to this slide, the rates of abuse of older folks have increased during COVID pandemic, both in community and institutions. A US study in the Journal of Geriatric Psychiatry have suggested that rates of abuse in community have increased by 84%. In the European Journal of Public Health, the overall estimates based on staff reports suggest that 64.2% of staff admitted to abusing older residents. Laura Tamblin-Watts, the CEO of CanAge, a national seniors advocacy group, in an interview with CTV News stated, and I'm quoting, "On a usual day, 1 in 5 older Canadians are subject to abuse, to elder abuse. And we're seeing a 10-fold increase in elder abuse across the community during the pandemic." And she said this April 14th, 2020. We've also seen further increase of caregiver stress and burnout. We see financial, emotional, and functional dependency on older adults have increased. For example, adult children moving back home with their parents due to loss of job or the loss of their home. We see the impact of social isolation on caregivers and older adults due to lockdowns. And we also see from the COVID, from the safety protocols that we've had for the last while, further causing a lack of human contact and social interaction. We saw a fear and concern about what is happening, all of which created anxiety, making older adults more susceptible when someone reaches out. And we see that with scammers and others who have ill intent. Now, an important point to note here is that abuse does not only happen to older adults that are frail or sick. Rather, abuse can happen to any older person. And because our focus is older people, I'm focusing on that, but clearly abuse can happen to anyone. Next, we're going to look at 5 general forms of elder abuse. And they are physical, sexual, psychological or emotional, financial, and neglect. And the World Health Organization provides definitions for each of these forms of abuse. And so they state, physical abuse is the infliction of pain or injury, physical coercion, a physical or drug-induced restraint. Example, hitting, punching, kicking, inappropriate use of drugs, and restraint. Sexual abuse is the non-consensual sexual contact of any kind with an older person. It can also include forcing the older adult to undress or watch sexually explicit images or activity. Psychological or emotional abuse is the infliction of mental or emotional anguish, such as yelling, ignoring, threatening, humiliation, controlling behavior, confinement, and isolation. Financial abuse is the illegal or improper exploitation or use of funds or resources of the older person. And neglect is the refusal or failure to fulfill a caregiving obligation that may or may not involve a conscious and intentional attempt to inflict physical or emotional distress on an older person. For example, not providing food, not providing housing, not providing medical care. So let's look at some societal risk factors. So there are specific characteristics of institutional settings that increase the risk for abuse for older adults. And this comes from the National Center for Biotechnology Information. And these risks include poor hiring and staff screening practices, staff burnout, stressful working conditions, poor compensation, the joint effects of resident aggression, and poor training of staff in the management of challenging behaviors. Financial cutbacks leading to the reduction in staff, which further lead to neglect. And then we look at the effect of the COVID-19 pandemic that has led to what is known as confinement syndrome. As older adults are confined to their rooms, or more broadly, those who are confined to their homes, unable to see, speak to, and spend time with those outside of their space, for example, friends and family, or to attend social activities and at events, the consequences of which have led to their hope disappearing and their health deteriorating. Next, we look at the warning signs. So the following are some controlling behaviors to look out and listen for from an older adult. So when they tell you that someone is making decisions for or about them without asking, isolating them from family and friends, threatening them with violence or abandonment, disregarding their privacy and personal dignity, reading or withholding their personal mail, or when there is unnecessary controlling of the older adult's money. Granted, this is not an exhaustive list of warning signs, but it does give you something to take note of. So who are most likely at risk of being abused? And that would be someone who lives alone, have limited ability to get out, and are dependent on others. Those who have a poor physical and or mental health. Those who are experiencing a cognitive impairment. Those with a history of abuse earlier on in their life. Those who are financially dependent, sharing accommodations, or involved in marriages that are predatory. So how can we help? Well, we can be watchful and aware. We can recognize the warning signs that we spoke about earlier. We can ask questions, making sure to do so in a non-judgmental way, with the idea to leave the doors of communication open with the older adult. We want to listen carefully to what the person says. We want to be supportive, letting the person tell you what it is that they need. We want to look up and share local resources. And I would have 2 slides that would look at some resources for you. So now that we know how to help, let's look at helpful things that we can say to an older adult who says to you that they are being abused. We want to say, I believe you. It is not your fault. I am worried or concerned about your safety and well-being. I will support you and your decisions, and to ask, how can I help? Next, we're going to look at a signal for help. And this is a signal for everyone. It's not necessarily for older adults. So let's practice it. So if you put your palm to the camera and you take your thumb and just tuck it in midway, and then you close your thumb or trap your thumb with your 4 fingers. This is the signal for help. And if you see someone use this signal, you want to check in with that person if it is safe to do so, and find out what it is that they need and what it is that they want for you to do. If you or someone you know is in immediate danger, you want to call 911 or your local emergency service. This is not a time to intercede if you or someone that you know is in immediate danger. Another thing that we can do to support an older adult who is being abused is to help them with safety planning. So personal documents are important and we want to protect them. So we can help an older adult put together what is called an emergency kit. And in emergency kit, you will have emergency phone numbers such as for family, for a neighbor, for a shelter. You want to make sure that they have some cash in there, extra clothing, glasses, hearing aids, assisted devices, a list of all the medications that they take with at least a 3-day supply. And then you want to make sure that all the pharmacy numbers for the medications that they take, that is also enclosed in that kit, because if they need to get refills, at least they will have the numbers. You want to ensure that they have copies of important documents, identification, SIN, passport, health card, banking information, and also the house key. You want to also help them to identify a safe place to go in and outside of the house, as well as to help them come up with an escape route so that they can get out of the home safely and quickly. So next we will aim to answer the question, is elder abuse a crime? So we'll do so by looking at 2 definitions as it relates to abuse of older adults. We will look at the violations of rights and freedoms, and we're going to look at systemic abuse. And this comes from the Canadian Network for the Prevention of Elder Abuse. And this is also another great resource. So it says it's a violation of rights and freedoms if somebody interferes with an older adult's ability to make choices, especially when those choices are protected under law. Examples include interfering with spiritual practices or traditions, withholding mail or information, denying privacy, preventing an older adult from having visitors, dictating how someone else can spend their own money, keeping someone in an institution without a legitimate reason. Systemic abuse, otherwise called institutional abuse, refers to rules, regulations, policies, and social practices that harm or discriminate against older adults. Systemic abuse includes rules that are developed for an apparently neutral purpose, but can hurt the person. Examples include using physical restraints as an easy way to prevent falls, or diapering a person instead of helping them to the washroom simply to save time or effort. Sometimes staff shortages can lead to systemic neglect. So Canada's criminal code allows for the following charges in relation to elder abuse. You will notice that there's a section for each offense for which charges are laid. So some examples: fraud, harassment, assault, intimidation, fail to provide necessities of life, threats, theft by power of attorney. Clearly, as we look at this slide, we can see that elder abuse is indeed a crime. So we spoke earlier about ways we can help an older adult who is being abused, such as listening, asking questions. But there are other immediate ways that we can support and create awareness. We can, for example, support World Elder Abuse Awareness Day that's coming up on June the 15th. We can get involved in our local aging services or organizations, and we can raise awareness by talking with friends, family, and colleagues, and include what you're learning today, what you've learned today, and what you will continue to learn today. So as I promised, I do have resources for you. For example, 211 Ontario, an incredible resource for programs and services, the Older Adult Information Line, prevention of elder abuse, and actually elder abuse prevention, they do a lot of webinars too, and they save them on their website. Great resources. If you're interested in joining a committee that focuses on elder abuse, these are some examples here. If you are a caregiver or know a caregiver, you can always connect with CHATS, our caregiver support team, or myself. Then again, some more resources for you are Ontario Caregiver Helpline, the Law Society, Legal Aid. So these are all great supports. So just remember, if you or someone is in imminent danger, you make sure and you call 911. Okay. So this comes to the end of part 2. Are there any questions? Maha, do you have anything in the chat? I will stop sharing. I know that was like, you need to take a breather, right?
I don't have any questions in the chat quite yet, but I invite anyone who has a question to type it out into the chat now, or else to just unmute yourself and speak. We'd love to hear if you have any questions. And, just on behalf of myself, Paula, thank you so much for your presentation. I learned a great deal about the resources that are available to deal with this very serious problem. So thank you.
Oh, you're very welcome. So did we do good time? I can't see my
perfect time.
You did fantastic on time. You did fantastic on time. We have about 7 minutes for questions.
Okay. If nothing is coming up, I can do a quick share of the website. Hold on, where did it go? Okay, hold on a second. Let me just come out of view. I'll close this.
I can see that Satya is sharing a comment with us. Good information on various issues. I totally agree, Satya.
And just to let you know that the Elder Abuse Prevention Across the Generations is a 6-week workshop where we cover various topics. In this first one, what is elder abuse? I kind of touched on a lot of the types of abuse. So we go into a lot more detail. We have like ageism and abuse, elder abuse and caregivers, financial abuse, sexual, physical, and psychological abuse, and mental health, addiction, and abuse. So, we do these workshops. If people are interested in any one of them, they can go all together or they can be like standalone, just to kind of provide a little bit more information. So let's see if I can find, I can go here. Can you see this, the website?
We can, yes.
Okay, great. So I talked about a lot of our programs and services. So all you do is to go to our website, chats.on.ca. And as you put your cursor down, programs and services, and simply click on any one of them. And it will give you a summary. If you go down to the one you're interested in and you click here, it will open up giving you more information about the program. For example, our adult day program. It's one of our programs that you have to go through the home and community support services for. And we've got them in Aurora, Richmond Hill, Maple, and in this North York area. And and then we have different details about the programs that are there. Did any questions pop up?
I do see a question. I apologize if I mispronounce your name, Sheni or Sheeny. Thank you for this very informative session. Would you have addresses for similar services in Quebec?
Is that for me?
Yes, I believe that's for you. Yes, yes, Paula.
In Quebec, I know we did this in conjunction with LW's Prevention Ontario. I can find out and let you know. Quebec. All right, I will connect with my contacts in LW's Prevention Ontario and ask them if you mean the workshops that I referred to? Is that what you were asking about?
Yeah, thank you, Paula. It was very, very interesting. And even though I don't live in Ontario, I have a lot of family there. So
Yes.
for me, it is useful, but I live here and I wanted to know similar services, whatever you're offering, and especially the addresses, the numbers, the phone numbers, the elders can contact. And yeah, just for me to have information for myself and people who surround me who are elders. Okay,
so you want to know our contact information?
Yes, if you have something similar in Quebec, if you know of anything, but if you don't, then that's okay.
I don't know about Quebec. I can see what I can find out for you.
Perfect. Yeah, that would be great. Thank you, dear.
Could you pop your maybe Maha, would you be providing? Could you provide that contact, or can I don't know.
I can.
Oh, wonderful! Thank you.
Yes, thank you so much, Hannah.
I can help you with that too, no problem.
Oh, good.
I appreciate the facilitation, Hannah. And this is actually a good moment for me to call attention to one other feature of today's event. We will be putting together a post-event package. So if you have questions that occur to you after the fact, we will be putting together a digital resource package. If you didn't provide me with your email ahead of time, please do provide me with your email and I'll do my best to make sure the package gets to you. And if you want to be linked up to any of our presenters today, pretty well all of them have said that they're welcome. They would welcome, sort of hearing from any participants today if they have follow-up questions. So please do reach out to us. And if there are questions we can't answer right now, we will follow up with you. I do see there's one more question in the chat from Jane. Paula, are the geographical restrictions as well as costs incurred for each program included on the website?
I will say, if you're looking, we do have fact sheets for each of the programs, and that will give you all the eligibility requirements. But I think it's worth, I always say, if you don't ask, you don't get. So it's always good to make that phone call and say, this is what I'm looking for. Do you provide that? How much does it cost, et cetera, et cetera. That would be my tip for you. Always ask. Doesn't hurt.
That's a great point. Yeah. And I do see that Joan has her hand up. Joan, would you like to ask a question?
Yes, and it's not around elder abuse. It's about people being discharged from hospital to home after surgery or other treatment, and they're single. I've unfortunately had to go through 2 surgeries, one in 2018, which was a mastectomy, and then again in 2019. The surgeon requested home care, a nursing visit, but there was, I don't know if she was a social worker or what, she came to your bed in the morning when the discharge nurse came, and despite what the surgeon had written, she was trying to determine if you really needed home care based on how you performed getting out of the bed, etc. Yeah. And the people at Lynn, they wanted you to take a taxi to come to their office for your treatment. I actually got home care from a nurse. They sent a nurse eventually, but it's after you got so demanding that you say, look, I've just had surgery. I can't walk. I need a walker.
Yeah.
If I take a taxi from my home to your center, if I fall in the parking lot, if I fall somewhere, who is responsible? The woman at Lynn, and this is the one at Box Grove, they don't care.
Yeah.
And I mean, that is crucial because the nurse who came, she did her assessment when she came. Unfortunately, I got nurse care. She says, here's what we'll do. We'll come every other day, not every day. So she stretched it out. But the people who manage it, they seem to be more profit-based than client-based.
I
And if they can take away your services, they will.
Yeah.
And something has to be done about that because you come out of the hospital, you've had massive surgery, you've been drugged, you're vulnerable. You feel, I'm not a weak person, but when you've had surgery like that, you feel like hell and you
Yeah.
don't know who to turn to. And you might have relatives, but they are just as traumatized as you are. And you're looking to Lynn or whomever to give you that support, and it's not always there.
Yeah.
And I don't know what you can do about that.
Well, we will be having to keep advocating and fighting and making it clear that the needs are not being met. One of the tips that I got, and you mentioned Lynn, which is, now their home and community support services. I got a tip, and I don't even know who's listening to this, but one of the things, advocating is hard and you have to fight when you want something. And it's unfortunate that we have to do that. But one of the things, if for the hospital to home program that I was talking about, if you are at one of those 3 hospitals, Mackenzie Health, South Lake Regional, and Oak Valley, you do have this added support, which it sounds as though what you needed. I didn't get your name. What was your name? Sorry. Joan. Sorry, Joan. So were you at one of those hospitals?
No, I was Markham Stouffville.
Yeah, that's what Oak Valley is called now.
Okay.
So, I don't know when that was, but they do have a hospital to home program. And the great part about this, and here's the other little tip. If nobody tells you about the hospital to home program and you are at those 3 hospitals, you ask about the hospital to home, because that is where not only do you get someone who will look after all your needs, but you get a doctors, nurses, social worker, the family, the caregiver, the community organizations are all part of creating a care plan for you. That's how. Now, these are the only 3 hospitals that are doing it at this time. I don't know if they were doing it at the time that you were there, but it's unfortunate that you have to ask for it if they don't offer it.
No, the doctor requested it. The services are there, but I found that the person who came, I don't know if it was a social worker, to do the assessment when you are being discharged.
Yeah.
She's not a medical person. She is a social worker. She does not know how you're physically feeling. The doctor has requested it, but she's trying to determine whether you really need it or not.
Yeah.
And then when you come home the first day or 2 after your surgery, you feel so weak. You can't get up.
Yeah.
I did get the service, but it was not as if it was forthcoming. You had to push a bit.
Yes.
And that
Yes.
shouldn't be.
I agree.
Okay.
I agree.
Anyway, that's my bit for the day.
Yes. Thank you for sharing, Joan.
You're quite welcome.
Thank you for sharing, Joan. I'm very sorry to hear that was your experience. And I think everyone here can understand the experience of feeling like they're not getting the support that they need, which is truly unfortunate. And I'm glad that we have people like Paula here who have the ability to share information with us so that we can advocate better for ourselves and for our loved ones when necessary. I do want to address just one more question quickly, and then we are going to move on to our next presentation. Kathy, would you like to ask your question to Paula now?
Sure. Hi, Paula, very informative session. I just wanted to ask, because my husband has been on 3 wait lists for the adult day program, 3 separate ones. And you just mentioned about these adult day program through CHATS. I have also signed up with CHATS. So are these all the same within the same programs? Like,
Yes, so so for adult day programs, you have to go through home and community care, and
which
they
I
will
did.
put you on multiple lists.
Correct.
As things change, we are adding more, we're opening it up a little bit more. So I know it's a bit of a pain in the butt to be on these lists, and it's so hard to get in, but we've had to, with CHATS, we're being very cautious in terms of our numbers and how many people come into the program. So I think, as the days go by, we're going to be able to add more people, but unfortunately, it's going to take some time. So yes, if you're going through, you can only go through the home and community care. So that is that you're connected there. And if you're flexible to say, hey, I will go to whichever adult day program I need for my, in order to get your husband to one. And also remember, we've got transportation too. So if you need transportation to and from, you can always connect with CHATS for that. I'm just throwing it out so that you don't have an added thing to think about, when you have them. And I've had great reports from our transportation drivers from my clients.
Okay, good to know. Thank you. Thank you.
You're welcome.
Well, on behalf of everyone, I would really like to thank you once again, Paula, for such an informative presentation.